Uh, First of all, I appreciate the organizer to put this session at first because I just arrived here in Brussels last night. I'm coming from Japan, and my time is getting close to the midnight. But I think I can still hang in if this is around this time, because it is still midnight. It is still before the midnight. So from next year, I will do my best to concentrate to facilitate this session. So first of all, let me start from explaining about the theme of this session. The theme is listening to the voice, listening to the perspectives from the field. And we are inviting representatives of the persons affected by leprosy and union leaders, namely from India, Indonesia, and Ghana. So through these seminars, we are going to hear from them how education or education sector or teacher can contribute to ending stigma and discrimination against persons affected by leprosy. So before moving on to the panel discussions, we have two keynote speech to highlight the global leprosy situations. So the first presentation will be made by Dr. Rao Pemaraju. He is the program advisor for medical issue of Sasakawa Health Foundation, and he is also the former acting team leader of WHO Global Leprosy Program. So Pemaraju, the floor is yours.
Thank you very much, Professor Nandri, for this opportunity. And good afternoon, ladies and gentlemen. I thank the organizers.
You're muted. We cannot hear your voice.
I think host can unmute me, please. Okay, am I audible?
Oh, we can't still hear you, Pemaraju. So please.
I have unmuted myself.
Any technical problems? Oh. Do we need to put on a headset to listen to his presentation?
I'm audible. Am I audible, please?
Yes, you are. Just wait for us. We have a technical issue in the room.
Thank you. Can you also put my presentation up, sir, Mr. Ahmed?
Yes, if you put on a headset, you're able to listen to the presentation. So, Pemaraju, please start again. We are ready.
Yeah. Thank you, Professor Nandri, for this opportunity. And I also thank the organizers, Educational International, and His Excellency, Mr. Sasakawa, for giving this time to present a brief update on global leprosy situation. I have a few slides. These talk about facts about the disease, figures as of now, as we see, and a perspective from a person affected by leprosy whom we have interacted during the treatment, and finally, achievements as of now where we are. Am I audible? Thank you. Can you go to the previous slide, please? Yeah. Thank you. Leprosy is a chronic infectious disease. It's not a sin. It's not hereditary disease. As Mr. Sasakawa has mentioned, it's a simple disease, but it has to be understood better. Diagnosis is mostly done clinically. We don't have a confirmatory laboratory test as of now. All of them are contributory. Starts with a patch on the skin. It's slightly less colored than the surrounding skin, but definitely does not have any sensation like feeling pain or touch or even temperature. Left untreated, this is the most important part. This infection spreads to the healthy individuals around, and the person affected might get impairment in his hands, feet, or eyes. Prevention is possible with the new WHO recommendation, and treatment is certain. With 6 to 12 months of treatment, the disease is completely curable. Next slide, please. A little more about the data, figures. Yes, thank you. Leprosy still exists in large numbers, as we can see. 133 countries have reported one or more cases of leprosy in the world. And totally 172,000 new patients have been detected. Of them, it's very interesting to note, of them, nearly 9,000 are children. This indicates that transmission is happening in the community. Nobody is born with leprosy. So it is an acquired infection. So people get infection in the community and they get the disease. And 40% are women. And it's more problematic. It's concerning to see that just because they are not diagnosed in time, nearly 9,000 people in 2024 had developed impairments, that is visible impairments and disabilities of grade 2. It's much more concerning that 280 or 300, nearly 300 children had disabilities of grade 2, which are permanent, persisting, and lifelong. That's the most difficult part of this whole disease. Eyes cannot see what the mind does not know. And as educationalists, the medical educationalists, they have a role to put this information in the minds of the healthcare workers so that diagnosis is done early and every patient gets treatment early. Next slide, please. Every digit of this data has a person beneath, has a human life beneath. I'm trying to present a story of a person whom I have seen during my work in Somalia. She has given me permission that we can talk about her so that we understand more about the disease. We are very grateful to her. They teach a lot. We learn a lot from the patients and their stories. She is a 27-year-old lady, and then when we visited internally displaced people's camp, we saw her with severe disease. Has been affected for the past 10 years. I've been going around to different doctors. She was even working as a maid in a doctor's house, but nobody recognized. Again, eyes cannot see what the mind doesn't know. They don't know about leprosy. That's a need for training of all the healthcare workers. She developed disability. But luckily, after complete treatment, she is back to normal. None of her 6 children had leprosy. That's something very happy to see as a clinician when we treated her at the end. Again, the issues are migration, refugees. We're not able to get them on treatment in time. And there is decreasing skills of the healthcare workers, and that is delaying the treatment, and they are becoming impaired, they are becoming having disabilities. Next slide, please. Having said this, where are we as of now? There are many achievements. We are grateful to Mr. Yohei Sasakawa that he has been spearheading advocacy initiatives as we saw. There are 20 global appeals involving people from different walks of life to spread the message that leprosy is curable and it can be treated, and only early diagnosis can help. Multi-drug therapy is available, and it has really made wonders. Introduced in 1980s, it has treated millions of patients, and the prevalence has come down from millions of patients to less than 200. But still, we have to move. There is a long way to go ahead to cut down the transmission and reduce the number of patients on treatment. Political commitment has been very much committed by many countries. As a milestone, most countries and globally, leprosy is eliminated as a public health problem. That means prevalence of leprosy has been brought down or reduced 1 patient for every 10,000 population. Still, we have a long way to go. And WHO continues to play their technical leadership role. But most important and most important opportunity that we need to capitalize is persons affected by leprosy organize themselves as a global forum and an oversight committee. And that's a great opportunity countries, stakeholders need to capitalize. Again, this is being very much promoted by Mr. Sasakawa. What persists in spite of these achievements is less understanding of leprosy in the community, at home, and even in the healthcare settings. So the disease, the disability, and the discrimination, and the prevailing stereotypes in the community cause discrimination against persons affected with leprosy. And it's time that we need to address that and reduce discrimination. That's a cross-cutting issue in all aspects. Because of discrimination, people do not come forward for treatment. Because of discrimination, they don't disclose the disease. And because of discrimination, they are deprived of education, employment, and so on. Next slide, please. This is the last part. Again, as an educationalist, I like the mention by David Edwardson says it's a central role, a significant and a very central role educationalists play. And let's convey about few short messages. Leprosy is a disease because of bacteria, and it can be treated with antibiotics. There's no need for isolation because treatment is available, and treatment is available in all health facilities. And discrimination on the basis of leprosy is not acceptable. And that does not help us to restore health, hope, and dignity to the persons affected by leprosy. All the stakeholders now have to synergize their efforts to improve to remove discrimination and ensure that human rights are respected. Thank you very much.
Thank you very much, Pema Raju. Yes, you are correct. Leprosy is not just a medical issue, but also the social issues. So now I want to invite another speaker, Dr. Alice Cruz. She is also the program advisor for the human rights issue of Sasaka Health Foundation. And also she is a former United Nations Special Rapporteur on the elimination of discrimination against persons affected by leprosy. So Alice, floor is yours.
Thank you very much, Professor Nandri, and all the organizers of this global appeal.
Can't hear you, Alice. You're muted.
No, I am not.
We can't hear you.
Yes. Do the people who are in charge of the technical issues can help? Because I'm not muted.
You're not muted.
No.
No.
So can anyone help with this technical?
It seems to be muted, Alice.
No, it's not.
No?
Can you hear me now?
Seems to have some technical problem.
So now what can we do? Self and unmuting. Can you hear me now?
No, I can still hear you.
Oh my goodness.
What's
Can
wrong?
you hear me? Pema Raju?
Can you somehow fix it?
You can hear me.
I can hear you.
Yeah.
I think the host can help you. I think it also happened to me.
Yeah.
Can anyone help? Please,
Hi.
because
Yes,
it doesn't.
we are looking into the issue. So we will move on with the other speaker, and then we'll come back to you if that's okay.
Oh, okay. Okay, that's
There's
okay.
a technical issue. We are fixing it. Okay.
Okay. Okay.
Yeah. Thank you.
Do you see? You need more time? Okay, so we can try to listen to the presentation made by Alice later. So we can move on to the panel discussions first because our time is running out. So we have 6 speakers. The 3 representatives of the persons affected by leprosy are from India, Indonesia, and Ghana. And the persons affected by leprosy from Indonesia and Ghana, unfortunately, they are not able to come physically, so they will participate virtually. So first, I want to ask a question to the representative of the persons affected by leprosy. So you can briefly introduce yourself. You can share some of your life stories too, and you can also introduce some connection with education sector. So first, I want to invite Bimla. Are you ready?
I am Bimla Kuzur, a member of Sacred Hearts of Jesus and Mary. I am a religious nun. Being a religious, I had an opportunity to serve children, youth, and also women. Especially, I was involved after my religious journey. I was involved with the prevention of women trafficking. So I was giving awareness and also rescue programs and different things. I was with the women, children, and youth. After that, I was also served the community for being a finance in charge, also the community animator, as well as also I had an opportunity to also to help the poor children for the free tuitions. So I was the coordinator also as a member of a community as a religious. But I was diagnosed in 2024 as a leprosy with this sickness. So I was involved that time with the children. So I was asked not to involve with the children because they are poor background also. My disease can contaminate. So in that way, I stopped continuing serving them and my involvement also. Actually, my struggle was since 2022. I was having some nerve complications, so I used to show to the neurologist, but they couldn't diagnose, could not identify that I am going through these symptoms. So it took almost 2 years to identify. I went to the various places, various doctors, and also various skin smear I had done, but it was coming negative. So finally, after 2 years with the skin biopsy, the disease was confirmed. So I started to take medications. 1 year of treatment I completed faithfully. After that, also due to delay of diagnosis, I have deformities. And also, so I had also the surgery. So that also couldn't succeed. It was not properly done, doctor is saying, then they are asking me to do once again. So in that way, my health has not much improved, and I'm also still struggling with the difficulties with the physical health issues, and various complications, and also deformities and disabilities. And also due to this disease, I couldn't continue my studies also because of my deformities, and also various involvement with the various sectors I couldn't due to my health issues and also complications also, and so because of this stigma and also discrimination many times has not allowed me to involve in many cases. So that was my experience being a patient, and also the experience of being also, though I came to know, I researched, it is not so much, it is not contagious at present what I am, but it is very difficult to convince others because of the fear and stigma, and also many places I am not being welcome. That is the experience being in India. Thank you.
Thank you very much, Bimla. For your information, she is a Catholic sister based in the Bhubaneswar state of Odisha in India, and Odisha state is one of the leprosy endemic states in India. Thank you very much. So next I want to invite the Miss Kasma from Indonesia. Sorry, we are supposed to hear the voices of the 2 persons affected by leprosy from Indonesia and Ghana virtually, but it seems we still have technical problems. So we have to skip the presentation now. So I want to move on to the requesting the introduction from the union leaders. So first I want to invite Mr. Kamara. You can introduce yourself, and you can also share. You can also introduce your organizations you belong to, with focusing on the education, inclusive education policy.
Hello. Namaskar. Good afternoon to all. Respected my brothers and sisters and colleagues. First of all, I congratulate to Education International and Sasakawa to give me opportunity to be here on a global issue. And when I reached today morning here, I felt that it should be discussed throughout the globally. And I am a primary teacher. I am working as the General Secretary of All India Primary Teacher Federation. My membership, 3.2 million teachers are my members, and 26 state affiliates. And we are spending 50% of our strength towards the children. Out of our strength, All India Primary Federation, we are spending 50% towards the children, how the children will come to the school and how they will get their quality education, inclusive education. So it is a part of that. The leprosy is the part of that. And in India, there are 760 colonies are there, leprosy colonies. They are not allowed to in our schools. But we tried our best to bring the children to schools. But we failed due to the area people, due to the village people. They are not allowed. They are fear of about that stigma and discrimination. So we precise the government, and now out of 760 colonies, we have established 80 specific schools for the leprosy students in their colony. So they are taking education in the leprosy colony. And it is a very strange, but there is no teacher. How to teach them? For example, some children's fingers are not working. So how they will write? There is no procedure, there is no government instruction. There are some children that are unable to walk due to the disease. So these are the problems faced by the teachers. So we, the general teachers, can't solve that problem. We are pressurized the government to take care and to appoint specific teacher for that school. So just sister told about that he is speaking English, very fluent English and good scholars. But due to this disease, he is feeling herself very innocent. So this is the things we are trying our best to bring all the children into the schools, though has suffering from this disease, handsome disease. So we are trying to create new schools in their colonies. Those colonies are far away from their village, 2 kilometers, 3 kilometers away from their village. Only these people are living there, those who are affected in the leprosy. So, brothers and sisters, All India Private Federation is doing its best to give them how quality education will give them and how they will get their fundamental rights in the education. We are trying our best. The association is trying our best, and for that, I'm giving heartily thanks to our David and the president of Education International. They are also cooperating us for these things, and also Sasakawa. First time I know about the Sasakawa, so I am also obliged to Sasakawa. So thank you. It is only 3 minutes you told, so after that I will participate.
Thank you so much, Kamala. I'm so impressed that you are paying attention to the leprosy colonies. As you may know, it is said that there are about 750 leprosy colonies in India. And the people living in the colonies are still suffering from poverty. And according to our statistics, more than 60% of the persons affected by leprosy are still surviving with begging. So it's very much important to pay attention to the people living there. So thank you very much. So I think now we are able to solve the technical issues. So I want to invite Ms. Kasma. She is a person affected by leprosy from Indonesia. So Kasma, please.
Thank you. My name is Kasmawati. I come from Indonesia. I am a person who has experience by leprosy. Just for a teacher. Daily activities teaching on organizing people affected by leprosy. I am the chairman of Permata Jeneponto Regency. Saat saya masih kelas 3 SMP, pada tahun 2010 saya didiagnosis dengan penyakit kusta.
Still in junior high school in 2010 when I was diagnosed with leprosy.
Dan saya merasa sangat terpukul.
I was quite beaten by that.
Saya tidak ingin teman-teman saya tahu tentang kondisi saya karena khawatir akan stigma yang mungkin timbul.
I didn't want anybody, my friends, to know about my condition because I was afraid of the stigma.
Namun, pada tahun 2020, saya bergabung dengan organisasi Permata.
But in 2020, I joined an organization of people affected by leprosy called Permata.
Dan itu menjadi titik balik bagi saya. Saya akhirnya bisa melepaskan stigma diri dan menemukan semangat baru.
This was the turning point for me. I could find back my spirit and my motivation and started the new life.
Setelah lulus kuliah S1 pendidikan, saya ditawarkan menjadi guru di salah satu sekolah yang ada di Kabupaten Jeneponto.
I studied, I made my bachelor in education, and I was accepted as a teacher in a junior high school in Jeneponto where I live.
Saya sangat bersemangat dengan profesi saya sebagai guru dan mengajar materi ilmu pengetahuan sosial.
I'm very happy and enthusiastic about teaching the students in the topic of social sciences.
Selama saya mengajar di sekolah tersebut, saya tidak pernah mendapatkan perlakuan diskriminasi.
As long as I've been working in that school, I have never experienced any stigmatization against myself.
Okay, thank you. Oke. Sekarang saya merasa bahwa saya harus memanfaatkan pendidikan dan profesi saya untuk menyampaikan pemahaman yang benar tentang kusta kepada murid.
I now have the feeling that I have to use my profession and my skills as a teacher to teach my students about leprosy.
Ataupun orang tua murid dan bahkan teman-teman kerja di sekolah yang masih memiliki stigma tentang penyakit kusta.
And not only the students, but also their parents and even the staff at the school who still have that fear and stigma about leprosy in themselves.
Saya ingin membantu menghilangkan stigma dan meningkatkan kesadaran masyarakat tentang penyakit kusta.
I want to help to reduce stigma and to reduce stigma in the communities in where I live.
Selain itu juga, saya semakin aktif untuk melakukan kunjungan rumah ke orang yang sedang dan pernah mengalami kusta untuk memberikan dukungan sebaya.
I'm also active conducting house visits to other people affected by leprosy to provide peer support to them.
Agar mereka dapat keluar dari sel stigma yang dirasakan sama halnya yang pernah saya alami.
So that they can overcome their own self-stigma, which I myself have experienced for a long time.
Begitu juga yang saya lakukan di masyarakat.
And I also do that in the communities,
Di mana saya berkunjung dari rumah ke rumah untuk memberikan penyuluhan tentang kusta agar tidak ada lagi pemahaman yang keliru mengenai penyakit kusta. Terima kasih.
where I visit house to house in the villages, provide information about leprosy so that all the misconceptions about leprosy can be corrected. Thank you very much.
Thank you very much, Kasma. As she mentioned, she is one of the leaders of the organization named Permata. And Permata is quite active to make a household visit of the leprosy patient and provide peer counseling by using their own experiences. So she's doing great activities on the field. So thank you very much, Kasma. Now I want to invite the union leader from Indonesia. So Uni, please.
Thank you very much. Good afternoon, all. Yes. First of all, I would like to express my sincere gratitude and appreciation to Sasakawa Health Foundation, Mr. Sasakawa, and also the Demian Foundation and Education International for your strong commitment and deep concern supporting the elimination of leprosy, especially in the country where cases in the disease are still emerging. In Indonesia, with I myself, Yunifa Roshidi, as the President of Teachers Association of the Republic of Indonesia, where has like a member about 3.1 million across the country. And I've been very long time campaign about the inclusion of education, but I never before I have to honest to say that I never talk about the leprosy before, but I was interested and impressed by Princess Diana when came to Indonesia and visited the hospital. Names the hospital is the Central Hospital for the Lepra. We in Indonesia we call it as a lepra, in English leprosy, and then it is and the stigma of people that the leprosy cannot be eliminated, so and then can be treated. So I think when we have been doing as for the campaign of the inclusion education is very important. And then before I'm leaving here, I met the director of the special services of special services which promoting inclusion of education, and I asked them, is it possible to eliminate the stigma of the leprosy? And they said that, okay, Ibu Yunifa, they call me Ibu Yunifa. Okay, Ibu Yunifa, it's part of our concern that the end of the stigma of the leprosy is very important, because before only for disability, people with the underachiever or high achiever, and then give them the opportunity to have a right of the quality of education. But since now, and I will also join with the Permata, and also in the mid of February, I will visit to Papua, where the disease of the leprosy increased. Some of the provinces in the eastern part of Indonesia, after poverty increase and also pandemic, I will say to the governor of the Papua and also the First Lady of Papua that should be put in the program, the priority program for eliminating the stigma of leprosy, I think. And since I know that it is very important, we will put in our priority program to eliminate the stigma of the end of the leprosy. I think that's in Indonesia. Thank you very much.
Thank you very much, Uni. I was thinking to ask for your commitment at the next question, but you already made some commitment to work on the leprosy. Thank you very much. And especially, as you know, the Indonesia is one of the high burden countries of leprosies, followed by India and Brazil. So it is really important for the leprosy communities to get a support from your organization. So thank you very much. So now I want to invite the Kofi, Mr. Kofi. He's a representative of the persons affected by leprosy from Ghana. You think we can hear from Kofi?
Hello, can you hear me? Hello, can you hear me?
Hear you.
Hello, can you hear me? Can you hear
We can hear
me?
you, Kofi. Please start
Good.
your presentation.
Good afternoon to everybody. In fact, today my heart is full of joy because the topic that you chose for this year, 2026 Global Appeal, is very, very dear to my heart. Because when I was diagnosed, most of the time I remember I sat under a mango tree in the child care home in a place called Ahunto Krom. I do remember around 1984. So most of the time I think of the strategy that I will use to be overcome this stigma associated with these diseases. When I was in school, at that time, it wasn't easy. So I decided to plan how I will overcome it. But because I'm in this position, because of education, without education, I don't think I will reach where I am now. I remember just recently, about I think 2 months ago, I had an invitation letter from our own president of Ghana, that is President Dramani Mama, that they are going to make a free tertiary education for persons living with disabilities. And then my name appeared. I was totally shocked to do the opening prayer. Without education, I don't think the president will even invite me. So I'm very, very happy about that. And to come to my education, this education have helped me to reach so many people. And then to become as a teacher. At first, many people thought when you have Hansen diseases or leprosy, only thing you can do to sit on the roadside or to sit and beg. But I have proved to people that when you have Hansen diseases or leprosy, people also can depend on you, because my school that I established in Ghana as a special school, that is school for children with Down syndrome, autistic, so on and so forth. It was the first school to be in Ghana before the one in Accra, Zolo. Because the missionaries asked me after I completed the school, and then I said, I want to become a teacher. And I remember one Reverend sister asked me, Kofi, why do you want to become a teacher? And then I said, I want to become a teacher, but not ordinarily a teacher with special education. So I was prepared to go to England to be trained to become a teacher. And with this education, Many people, sometimes people will come to my office. Some of them are MPs, some of them are ministers, some of them are other high positions. They will come to my office with their chart for enrollment, and then they will ask for the overall boss of the school. And I said, here I am. And sometimes they will shock. So I will appeal to everybody. This year topic that you chose is really, really dear to my heart. Thank you.
Thank you very much, Kofi. For your information, the Kofi is one of the pioneers of the movement of the persons affected by leprosy internationally. He is one of the few persons who started raising voice as a person affected by leprosy. So he was supposed to come here physically, but because of the visa issue, he couldn't make it. So Kofi, thank you very much, and we miss you a lot. So now I want to invite Ali from Ghana, representing the union there.
Thank you very much. I'm Kinali Audu. My union is Pre-Tertiary Teachers Association of Ghana. That deals with KG, primary, junior high school, and then senior high school teachers. In Ghana, leprosy is well managed. Currently, we are below the World Health Organization ratio of 10 to 1 million. We are between 7 to 8. Until 2023, 2024, prevalent rate was very low. However, when COVID came in 2020, 2021, 2022, focus on contact tracing for leprosy and identifying people with leprosy went down. The entire attention went to COVID and contact tracing for COVID. So in 2024, we had one of our highest rates of about 278 for the first time since 2019. But that notwithstanding, the government of Ghana in 2006 passed the Disability Act to make discrimination against any form of diseases, against any form of disability, including leprosy, a crime. And then in 2008, government passed the New Education Act with inclusive education at its heart. In September 2015, the Ministry of Education wrote out the policy of inclusive education and then guideline for teachers to start teaching students and pupils in pre-tertiary education to stop discrimination and stigma to people living with disabilities. Currently, the little challenge we have are those in the primary school. The children are quite young, 5 years, 6 years, 7 years, 8 years, 9 years, 10 years. So when people with disabilities at that stage, they laugh at them, not because they are discriminating against them, but because they are children and they do not actually understand what they are doing to their fellow children. The Ministry of Health have challenge with funding in contact tracing. So many people in Ghana are diagnosed with Hansen's disease at the grade 2 disability level. That makes it difficult because even after complete treatment using the multi-drug therapy, the people still continue to live with the disability. The government of Ghana has increased funding with the current, our new president, increased funding to the National Leprosy Control Program. So people can be detected at an early stage when impairment and disabilities haven't set in. Recently, as Kofi said, the president have launched a special policy to make sure that all people with disabilities are included in pre-tertiary education so that we can dismantle the special schools where people living with disabilities are grouped alone in special schools and are being taught. So we are looking forward that by the year end 2026 up to the second half of 2027, we will be able to incorporate all people living with disabilities, Hansen's disease inclusive, to our normal stream schools. For students in junior high school and senior high school, we have been able to educate them to stop stigmatization and discrimination. The challenge we have is at the KG and the primary school especially. The students, as I said earlier, are young. They laugh at their colleagues, not because they are discriminating against them, but they see it as fun. For that reason, if more energy is not put in, some of the children will stop school at that early stage. Finally, the Ministry of Education 2015 developed the Teachers Guideline for Inclusive Education and then how to deal with stigma. And there are some senior colleges of education in Ghana where teachers are trained for special education so that they come in, they go to the schools and make sure that stigma becomes a thing of the past. Thank you very much.
Thank you very much, Ali. I think you are correct. Also, the leprosy still exists in Ghana, but Ghana is managing leprosy properly compared to other African countries at least, because we are working with more than 10 countries in Africa. Still, stigma and discrimination are very much severe. So maybe by working with organization Coffee, for instance, you can present some model to other African countries. Thank you very much. Well, time is very much running out, and I'm strictly instructed by the organizer to finish these sessions on time. So we still have 13 minutes. So I want to invite each of you again for one more point. To the representative of the persons affected by leprosy, in 2 minutes, I want to ask you to share your recommendations and suggestions to the union leaders, how they are able to contribute for ending stigma and discriminations. So I want to start from Bimla from India. In 2 minutes, please.
Actually, I am affected leprosy from I'm not from a colonies. So I feel that like me, those who are not belong to the colonies of a leprosy colony and being affected, I think they need to gather and also give awareness about that stigma and discriminations that are taking place in their personal life. Because being a religious, I have experienced the stigma and also discrimination, and also failed to avail all the my future career because of my disabilities. So if I am being in India, actually we are not exclusive in educations. If many places will be not allowed to study together, being a leprosy. So in that way, I feel that the awareness has to be given to the people so that the person who are affected also can stand for their right and their needs and that are availing. So I think the organizations and also the government that are actively involved on the leprosy, they should also intervene in finding out gathering the patients, those who are affected by leprosy and facing different challenges, and so that need to work upon, because nothing should be discussed about us without us. So the whatever the challenges that we are facing, not able to continue the education, not able to carry out our interest that we are interest in involving in different jobs, different works. So that should be addressed if the awareness and if that can be heard from us. That way I feel. And also like our educations and also the health facility that is particular for all, it is not exclusive. No, so like for leprosy people, they have certain place to go for treatment. Like we have for my surgery, I had to go to a place where the leprosy people are being have to go through the surgery. So if I don't do there, I have, because I had gone to that place and the facilities were not appropriate for me, because so it was very difficult to stay in that place for 10 days where the facilities were not for the treatment. So and not being that colony, being a patient not from that colony, leprosy colony, going to that place made me very difficult. So in that way also I feel that this kind of feelings has to be addressed and also taken care by the government and the organizations and also the facility that are there. So that way I felt, because if it is being, I am not from that colony and the education, if I need to go that place for my educations, what I couldn't succeed because of this disease, it will be very degrading for me. It will be very difficult for me. So that is the suggestion that I feel that. And also other countries, how they are inclusive regarding the educations for the people affected by this disease. Should be also government of India should try on this. And also the and at present also the colonies, we have various colonies, they prefer to have their facility, education facility, health facilities, because they are not welcomed. They are discriminated, they were rejected, they are not accepted. So in that way, not being understood, in that way they prefer to have their separate facilities for their need, like education, health, and which is our right. So in that way also need to be taken care of. So if they prefer, the colonies should have different facilities on education or health, and government should also provide that in that colonies. And also the colonies also require their settlement to stay separate in their, so in this kind of things should, and also the education is a primary role, like me feeling being stigmatized with this disease because of the, what I hear from the surrounding, and also this kind of opportunity platform that give courage to accept this disease. Because I feel I am healed because of this, the global appeal that I attended last year. So that helped me to declare myself that I am a patient, a leprosy patient, which helped me to also overcome from my fear, and also like not able to say it, but owning my disease, and also able to disclose and able to share, which in the primary stage I was struggled, and I feel that I am healed now, able to speak. Now I get courage also to, if I go to my own place, I can share also, and also I can help others, those who are like me suffering, to own the disease and also disclose the disease, and also to be understood what the person goes through. Because in day-to-day life, certainly due to the stigma that have in India and also discrimination, we face lots of challenges. But this has made me to realize how a person feels about being a patient to it. So.
Thank you very much, Bimla. So, Kamala, can you quickly share your reflections?
Thank you, sir. So, it is a very critical issue, Because how to convince the people, how to convince the guardians, how to convince the society, and how to convince the children, it is very too difficult for a general teacher. The teacher should be technically trained, I think so. Because when you are talking about this issue, when you are talking about this leprosy, with the leprosy patient, they are hesitating. They are not talking with perfectly. Even if we want to bring their children to the school, they are keeping barrier. Therefore, they are helping us. They are earning money. When they are going to begging, their children are helping them. So they are earning money. The children are earning money for them, for the society, for the family. Another thing, we should create awareness among the teachers through newspaper, through posters, through essay competition within the children. There are many strategies to reach the target. And we have also decided by 2030, we have to completely finish the leprosy diseases from the country. The teachers, we the teachers are thinking that we are preparing plan of action. We are talking with the government, and most important thing is that there is separate hospital for them. There is separate hospital for the patients, not for the general hospital. They are not coming to a general hospital where I am getting treatment. So that should be one hospital to create awareness that it is not it is a contagious disease, but not human disease, but it is not, it is curable. These things should come. In our society, it is called as curse. It is curse due to some things he is getting this disease. That's curse. Till today, we have that idea. So that should be clear from the mind of the people. That should be clear from the mind of the general people. You will be astonished. In India, in my state, that is Odisha, there is a temple, Konark temple, Black Pagoda. It was constructed 12 years ago. And that was for the, specific for the leprosy. When Krishna's son, Shambho, was suffering from leprosy, he told the king to worship sun god, Surya Devata. You know sun god? If you worship sun god, the leprosy will be come down. Because the leprosy is due to the vitamin D. Vitamin D, leprosy is increasing. So we should every day 5 to 10 minutes before the sun. We pray to sun, we offer water to the sun, then vitamin D will come to the body. So this is regionally, till now we are conducting that Shambho Dasami, and on that day, whole the country worshiping the sun for the year of leprosy disease. So leprosy slowly came down. Now in India, 1.13 million leprosy are there in the colonies, 760 colonies they are living, and we are already 85 colonies talk to these people, and we're taking care of how to give them the education. Inclusion education is there, but there is no policy of the government. The paper is there, the documents is there, but there is no policy, there is no cooperation from government. Government taking any risk to give them quality education. They are not providing school for those who are no finger, how they will teach, how they will write. Those who are not fingers, fingers, how they will come to the schools. Some people are affected by the eyes, how they will see. There is no provision. We are talking about these things. So first awareness among the community that it is curable, and we should take prevention before when we see that some reddish or some color patch is coming to your body, you should take care of that. And there are 2 to 3 types of, in some patients, their finger, hand that is not attacked by the disease, but their color becoming white. white leprosy. That is white leprosy. So we have to treat that. Whole body becomes white. So that is one kind of leprosy. So leprosy is many kinds of leprosy. We have to take the care of that, and government freely distributed medicine for the leprosy through the school, through the teacher. We are giving medicine yearly once to the students for that leprosy. So we have to create awareness among the association from block level to national level, and we have to pressurize the government to keep to inclusion education. If you are talking about inclusion education, so they must come to the school, or they must take the education, quality education. So we have to fight for that. So I think if we will take more initiative, then we will get the target. I think so. Thank you.
Thank you, Kamara. The time is really running out. So I hope the speakers can be quick. So now I want to invite Kasma. Kasma, can you quickly share your suggestions and recommendations? Kasma, are you there? She has left.
What?
Share your reflections.
Thank you. So I think Union has a very pivotal role in eliminating the stigma of the leprosy. At least Union can influence the policy of the government, and it needs like a political will. I will urge to the government to demand of giving the opportunity to do inclusive education, not for only for the people with disability, but also for leprosy. Indonesia has a very Indonesia has a big achievement before in order to eliminate leprosy in 1980, I think, 86, 80 before. And I also will urge to the government to use like people who very well known to say that that leprosy also can be deleted, can be treated like a normal people, and education as a key role, and then we'll advocate will advocate to the government, both national and the local level, and also in the classroom, and also will say to give the opportunity to the education, that inclusive education should be treated, should be given to the people, not only for the disability, but also for all people are included leprosy. Thank you very much.
Thank you very much, Uni. Coffee, are you still there?
Yes, I'm still here.
Please quickly share your suggestion. Time is really running out, so I hope you can be very brief.
What I would say to the whole world today is that anything that has beginning has the end also. So I will appeal to the whole world that especially we people affected by Hansen diseases or leprosy, we should not give up. And then you should not say, oh, this is impossible. This is impossible. Most of the time, I said to myself, sometimes with SHS, Sometimes the things that you think is impossible, it will turn possible. I'm saying this because in some part of Ghana, especially Pandai, some of the colony, there was a stigmatized around 2007. So we decided to make a borehole. This borehole was in the colony. And then people saw that the people affected by leprosy are enjoying good water. So the community of Pandai decided, no, why not go to this colony and fetch water? So we people affected have to move forward. We have to move forward. We have to learn more the strategy that you can overcome this stigma. On behalf of the people affected, especially in the Africa, I salute SHS, especially the Goodwill Ambassador. The things that your team and you yourself have done for the people of Africa. Thank you. I will end here.
Thank you very much, Kofi. So Ali, can you quickly respond to Kofi?
Thank you very much. So as I said earlier, Ghana way back in 2006 has passed the Disability Act to criminalize stigmatizing and discriminating against people living with disabilities. Ghana is working hard to eliminate leprosy. One of our biggest challenges is funding. Currently in the world, the first world do not have leprosy. Leprosy prevalence is largely in the third world. And what we need is advocacy and funding, so we will be able to eliminate leprosy completely. Though it is a crime to stigmatize against somebody with leprosy in Ghana today, there are some places in the remote areas in the country where people are still discriminated against. We are working seriously on that. Some of the cases, you may not even hear about it. So yes, Ghana is an example in Africa, but there are still a lot of countries in Africa like Nigeria, Democratic Republic of Congo, Mozambique, and the rest, where prevalent rate of leprosy is still very high. Again, the third world countries is where we still have leprosy in large numbers. Thanks to Sasakawa, to the Damien Education International. But more funding is needed if leprosy is to be eliminated completely in the third world, just as it has been done in the first world. Thank you.
Thank you very much, Ali. I know time is really running out, but just give me one more minute. I want to invite Alice to make a concluding remarks. She was supposed to make a keynote speech, but because of the technical matters, Alice, you can conclude this session if it is okay with you.
Thank you so much for the opportunity. Can you hear me now? No?
We can hear you.
You can? Yes.
Yes, we can hear you. Go ahead.
Well, I'll be very quick. Thank you, Professor Nandri. Please allow me to greet the WHO Goodwill Ambassador and Education International, and also my colleagues from SHF for organizing this very important event. Professor Nandri, I'll be quick, and I want to say that in some ways I am a bit relieved that I didn't deliver my speech, and I will explain why. For me, the time where people like myself explain to others what discrimination is has passed. I know Ms. Maguette, the chair of the Oversight Committee, gave a very important speech today. And I also want to thank Ms. Kasma, Ms. Bimla, and Mr. Kofi, who I really miss, for all that they shared. We must listen to their voices directly. They know what discrimination is, but also what the solutions are better than anyone. And since this is about talking from the field, please let me share that I am currently in the field of a non-endemic country where I found very severe forms of discrimination. Persons affected by leprosy go to the healthcare services for receiving medical care, and they are called the L word and told to go away. What I want to say with this is that the decrease of leprosy cases doesn't mean that discrimination is being eliminated. On the contrary, what we see is that most governments are losing interest in leprosy. So these synergies that the Goodwill Ambassador keeps trying to motivate are really important. And just to finish, we heard from Ms. Kasma, from Ms. Bilma, from Mr. Coffey, how education can change people's lives. And when those lives are changed, they change other people's lives. So we need to work together to make sure that persons affected by Hansen's disease have access to education. And that comes not only with policies that include inclusive education for them, but also disability measures and that make sure that children with leprosy-related disabilities can stay and progress at school. And sometimes we will also need affirmative measures, special measures that somehow give priority to persons affected by leprosy in the education system. So with this, I finish thanking everyone so much and also making an appeal for us to focus on working at the local level where persons affected by Hansen's disease are already fighting so hard to beat stigma, to beat the disease. And it is our mission, I believe, all of us, to support that important work, but always reminding ourselves that they should be at the forefront, and we are here merely to support them. Thank you so much.
Thank you very much, Alice. Sorry about the bad time managing. So please join me in thanking to all the speakers again. Thank you very much.